Infective endocarditis. Here the word infective, it represents a microbial infection. Mostly it's bacterial, but it can also be fungal, rickettsial, and chlamydia can also cause this endocarditis. Next is the endocarditis, and it represents mural endocardium and the heart valves that are mostly involved in endocarditis. But aorta, aneurysm sacs, blood vessels, and prosthetic devices can be infected. So what actually happens is that there are formations of vegetations. What are vegetations? Vegetations are composed of organisms, or microbial organisms, inflammatory cells, and thrombotic debris. Okay. Next we have two types. One is acute and other is subacute. It is more destructive as compared to this, and it's chronic. Here a more virulent organism is involved, but in case of the subacute, the organism is less virulent. In case of acute, the valves, they are normal previously, whereas in case of subacute, the valves are abnormal. So high mortality in case of acute, whereas if properly treated, subacute, in case of subacute, complete recovery can occur. So here, after the formation of vegetations, it's associated with destruction of underlying cardiac tissues. Next is pathogenesis. So the valves, they can be normal, cardiac abnormalities can be present, and they predispose towards the infective endocarditis. Prosthetic heart valves, flow jets. So flow jets actually refers to the velocity of the blood. In case of a troubled heart, there actually happens that the blood strikes at some surface more than as compared to the other. As a result, the endothelium there becomes irregular. Pacemaker lines and vascular catheters, there can platelet and fibrin deposits can occur. Neutropenia, malignancy, diabetes mellitus, alcohol and IV drug abuse also predisposes towards infective endocarditis. Strep viridians accounts for 50 to 60% cases, and in these cases the heart valves, they are damaged previously. Strep aureus, they account for 10 to 20% cases, and in these cases the valves can be healthy and deformed. Next, in 10% of cases, no organism is found, and it's because of the antibiotic therapy or the organisms, they are deeply embedded in vegetations that they are not released in blood and detected. Next is seeding of blood with microbes that can occur during dental procedure, infection, surgery, IV contamination, and occult source from gut or oral cavity. Next is the morphology. So bulky destructive vegetations occur, and as I told earlier, vegetations are composed of fibrin, inflammatory cells, and microorganisms. Mostly aortic and mitral valves are involved, but tricuspid is also common in IV drug abusers. So one or more vegetations can form and one or more valves can be involved. So there actually occurs ring abscesses. How the vegetations, they erode the myocardium, resulting in the formation of ring abscesses. From the vegetations, embolus can form. So these vegetations are friable, and shedding of emboli, these emboli, they carries the infection, and when they lodge at some point, they can cause abscess, septic infarcts, and mycotic aneurysms. In case of subacute, chronic inflammatory infiltrates occur, and granulation tissue is found at the base, and fibrosis and calcification can occur. Let's move toward the clinical features. So in case of acute, fever, chills, weakness, and lassitude occurs, whereas in case of subacute, fatigue, weight loss, flu-like syndrome, and splenomegaly are present. Next, these are petechial hemorrhages, nail bed involvement in which splinter hemorrhages are present, Roth spots are present, that are retinal hemorrhages, genuine lesions, that are painless palms and sole erythematous lesions, and osseous nodes can occur, that are painful fingertip nodules. So mostly it is detected with the help of positive blood cultures or echocardiography. Septicemia, arrhythmias, systemic embolization can occur. So if you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.